Yeah, I'm Dr. Sharath Reddy, Consultant Interventional Cardiologist, Executive Director, Maxcure Hospitals, Madhapur. Today, I discuss about diabetes and heart disease and its relation. So, medically, diabetes is considered as equivalent of heart disease in terms of treating patients. So, if a patient is diabetic, so we consider them, they also have a heart disease, and we start all primary prevention measures for the patients. So why diabetes increases person's chances of heart disease? So diabetes, by very nature of increased insulin resistance and poor glycemic control, increased cholesterol levels, so it increases tendency of atherosclerosis in blood vessels of body. So the increased tendency for atherosclerosis generally affects heart vessels and the aorta, that is the main vessel of the body, and cerebral vessels. So these are the vessels which are commonly affected by atherosclerosis. So atherosclerosis is nothing but deposition of cholesterol in the inner layer of the blood vessel. So this cholesterol deposition gradually reduces lumen size of the blood vessel. So the blood vessel will gradually occlude over a period of time, so leading to heart diseases. So when the blood vessel is occluded, so it slowly causes dysfunction of the heart muscle, and sometimes that occluded blood vessel, the portion of occlusion can get ruptured, and there can be a blood clot formation which leads to acute heart strokes. So overall, this diabetes, by increasing atherogenicity in a patient, it increases his chances of having heart disease, especially coronary artery disease in future. So that is the reason whenever they were diagnosed as a diabetic, so we will always do a cardiac checkup to understand whether they already developed cardiac disease or not. And post that checkup, we always start some primary prevention measures for diabetics. Like we may start one antiplatelet, that is aspirin. Most of the people knows we start aspirin 75 mg once daily as a primary prevention measure. And we also check their cholesterol levels. If their LDL cholesterol is beyond 70, then we treat their LDL cholesterol to reduce their chance of heart disease in future. So these are the two main interventions, medical interventions which we do in all diabetics to reduce their chance of coronary artery disease in future.